I mean, that's an amazing set of resources, and I'm sure we could spend the rest of the hour talking about just the research that's happening. How is that being applied? How have some of these researchers pivoted to address COVID-19, and what's happening in the university with respect to the response to COVID-19?
Most of our efforts on COVID-19. So we are doing some of the very first clinical trials. There's been a lot of press over the Pfizer RNA vaccine candidate that just began testing in the U.S. And we were actually the first to begin a clinical trial. And this is a Pfizer vaccine that they hope to bring to the market as early as September. And we started enrolling patients on Monday and injecting patients on Monday, and we're one of just four centers in the country doing those clinical trials. Just 2 weeks ago, we were working with the Gilead potential therapeutic remdesivir for COVID-19, which is one of the more promising therapeutics. So we've started those clinical trials as well. We currently have a team at the university that's evaluating, we've had 50 or 60 suggestions of clinical trials. And so we're actually going through that list and wanting to really focus our efforts to do the highest impact trials. So I expect we'll do another half dozen or more COVID-19 related clinical trials. Mm-hmm. I mentioned Claire Fraser. Her group in the Institute for Genome Sciences, with support from the state, is building up the capacity to do high volume, rapid testing of COVID-19. And over the next several months, we're working to build the capacity that we'll be able to do 20,000 tests a day for COVID-19. And that we received some very nice support, $2.5 million from the governor to help build up that capacity. Mm-hmm. So with the whole infectious disease area and the genomics, we were in pretty good shape to really hit the ground running and be one of the leading centers in the country to try to address this. I will mention also our other schools that you wouldn't necessarily think of getting involved in COVID-19. Our law school has had a very strong program, really dating back to 9/11 on emergency preparedness. So they've put in emergency preparedness plans around the country and have worked with county and jurisdictions and the university. So we're tackling it from that angle. And then, of course, COVID-19 is really impacting the poorest communities in Maryland and around the country, and our School of Social Work, which is very engaged in working with those communities and dealing with health disparities. It's become all the more critical with COVID-19, the way that's been attacking the poorest of our citizens. So all the schools have really got an important role to play here.